A great technique for your stenotic patients is axial separation and flexion. So to do that, I'm going to want to make sure my bottom leg is bent. And then I'm going to straighten the top leg. I'm going to have their arm hang off the table to put them into even more flexion. I'm going to come around. I'll put my hand under their clothing around the greater trochanter and press caudally. And I can hold this for about 3 minutes on both sides. So this is a great technique to help open up those spaces and give relief for the nerve and also help increase disc height. Another alternative you can do that will help open up these spaces and help with your patient's hip mobility is some indirect traction on the coxofemoral joint. And this will be a great technique to prepare us for our extension curve glides. So for our extension curve glides, I'm going to be mobilizing at the greater trochanter. I'm going to pull the patient's leg into extension, adduction, and internal rotation. And I can even have them move their leg with me, which would help facilitate a little bit of neuromuscular re-education. So the patient's providing the osteokinematic motion, the therapist is providing the arthrokinematic motion. So if we add in extension, adduction, internal rotation, that can really help with the patient's gait cycle. Okay. So some techniques to work on with the patient's hip and extension. We'll keep the bottom legs in flexion to help with their lumbar spine. You can kind of relax your arm and just put the patient's arm in a position that's comfortable for them. And I can work on releasing this patient's psoas. So I like to start with finding the ASIS and then just going medial. And then when I find tight or tender places, applying a little press and stretch or transverse friction massage. I can also come in front of the patient and use my thumbs and have the patient press into my forearm. Good. And then relax for a little contract and relax. Good. Press into my forearm. Good. Relax. I can also have my patient come more at a posterior pelvic tilt, kind of work in that motion at the same time while I'm coming up under that ASIS and going down just caudally and working on that hip flexor. But often when their hip flexors are really tight, that's going to put your patient at an increased lumbar lordosis, further irritating that really stenotic spot. I can also work on the patient's lats. So I can ask for shoulder elevation and really working on that periscapular area. So here I'll find a limitation, press in with my thumb, and then stretch the patient's arm further into elevation. With these patients, we really want to work on thoracic rotation. Bring your knee up. And thoracic extension. as well as hip extension and releasing the hip flexors. All of those areas are really going to help us offload that lumbar spine. And then after all my techniques, I can go back on the lumbar spine, do some manual lymphatic drainage, pumping all the microedema up to the L1 area. Then I would repeat it on the other side.